Have you ever gone to empty your bowels and the stench from your poop was so overwhelming that the smell from 1,000 rotten eggs or a decomposing rat in your bedroom appears far more tolerable? In such instances, of course, you wouldn't want to view the poop, but peradventure, in trying to flush the toilet, you realize that the poop is somewhat stubborn because it's greasy and floating. And let's also assume that you eventually got it flushed after several attempts. If you still notice a messy oil film on the inner walls of the toilet bowl or on the toilet water, that could be an indication of poor nutrient absorption, meaning your pancreas is being hampered from doing its job. The pancreas, which is an amazing J-shaped organ that lies behind the stomach, produces digestive enzymes that aid in the digestion of food and also hormones that help with the regulation of blood sugar. And so whenever it is diseased and doesn't produce or release these digestive enzymes, your stool will look very uninteresting, funky, and greasy, coupled with a highly intolerable stench. Permit me to bring to your notice that the messy oil film on the toilet after flushing is the dietary fat that your body failed to break down because of the absence of pancreatic or digestive enzyme. If your poop occasionally matches the description I made earlier, then there is no need to freak out. However, if all your poop possesses those traits, then there's a huge problem. Why? Because you've got some pancreatitis issues to handle, especially if it's accompanied by sudden abdominal pain that ranges to the back, bloating, indigestion, and even vomiting. Pancreatitis isn't a failure you want to take for granted. Although it may not appear so scary, but it could be the one reason you might embrace death prematurely if it is not addressed timely. Pancreatitis simply means inflammation of the pancreas, and it could be acute, meaning lasting for a short period of time, or chronic, meaning prolonged. Acute pancreatitis is usually caused by gallstones, and it's also experienced by those who make alcohol their companion. But sometimes the cause may be unknown. Funny, right? In medicine, we call that idiopathic. And can I tell you that gallstones become a reality in your gallbladder when your liver churns out more cholesterol than your bile can dissolve. The excess cholesterol eventually crystallizes into stones, and when the resulting gallstones find their way out of the gallbladder, they block the bile duct, thereby giving rise to pancreatitis. Wonder why I mentioned earlier alcohol can be a culprit? I'll tell you. When you drink too much within a short time frame, the alcohol prematurely activates the digestive enzymes within your pancreas, causing the enzyme to start digesting the pancreas itself. This is really a horrible situation that's totally avoidable. If this continues, it can cause serious, irreversible damage and can increase your risk of pancreatic cancer. Now, some less common causes of the acute pancreatitis include 1. Certain medicines. 2. Viruses like mumps and measles. 3. Accidental damage or injury to the pancreas. For example, during a procedure to remove gallstones or to examine the pancreas. 4. Hypertriglyceridemia, which occurs when the blood levels of a type of fat called triglyceride is high. 5. High blood calcium levels, also known as hypercalcemia. One is probably more likely to develop severe pancreatitis if one is obese, have 2 or more alcohol drinks per day, smokes, have a family history of pancreatitis, or is over 70. Now, for the diagnosis of pancreatitis to be done, a blood test is needed alongside an ultrasound scan, and sometimes a CT scan also. The ultrasound scan is done to view the pancreas and to figure out if gallstones are present. People with mild acute pancreatitis usually start to get better within a week, while those with severe acute pancreatitis may need to be admitted to an ICU, also known as an intensive care unit. Recovery is possible, but one is also likely to depart the earth from there. Remember, I had earlier differentiated acute from chronic pancreatitis by stating that acute is sudden and short in duration, while chronic is prolonged and does not improve over time. Nevertheless, recurrent acute pancreatitis can lead to the emergence of chronic pancreatitis. Less common causes of chronic pancreatitis include 1. Smoking. 2. Autoimmune chronic pancreatitis. This occurs when the immune system starts attacking the pancreas. And thirdly, inheriting a faulty gene that stops the pancreas from working properly. Sometimes the symptoms of chronic pancreatitis can be very similar to pancreatic cancer, thereby making it imperative to do a biopsy to rule it out. But it's absolutely vital to know that although chronic pancreatitis increases your risk of pancreatic cancer, the chance is still very small. It is somewhat apparent that there's a link between having a high cholesterol and developing gallstones. And so eating too many fatty foods with a high cholesterol content should be avoided. Also, since obesity is somewhat associated with the development of gallstones, maintaining a healthy weight by eating a balanced diet and doing regular exercises to reduce your risk is a wise path to navigate. You can further reduce the risk of developing acute pancreatitis by cutting back on drinking alcohol. However, if you've had acute pancreatitis caused by drinking too much alcohol, cutting back on drinking is no longer an option. You should rather avoid it completely. Currently, there's no specific medication that is used to treat acute pancreatitis. Therapy is primarily supportive, and involve 1. Intravenous fluid hydration, since acute pancreatitis can cause dehydration. 2. Analgesics to help resolve tummy pain associated with it. Some of these painkillers can make you feel very drowsy. And so if you're visiting someone who is in the hospital with acute pancreatitis, don't be alarmed or concerned if they appear drowsy or unresponsive. 3. Antibiotics can be employed especially in severe pancreatitis in order to address any concomitant infection. 4. Nutritional support. This is usually needed in severe pancreatitis as solid food will be avoided for a few days or longer. This is because trying to digest solid food could put too much strain on your pancreas. In nutritional support, you're given a special fluid, a special liquid food mixture with the nutrients you need through a tube in your tummy, also known as enteral feeding. Once the condition is under control, the underlying cause may need treating. If it is due to gallstones, you may need a procedure called an endoscopic retrograde cholangiopancreatogram, ERCP, or your gallbladder may need to be removed. Having your gallbladder removed shouldn't have a big effect on your health, but it might make it more difficult for you to digest any food such as fatty or spicy food. If your pancreatitis is due to alcohol consumption, then complete avoidance of alcohol cannot be overemphasized. It's not uncommon that some people with acute pancreatitis have a dependency on alcohol and need help and support to stop drinking. Alcohol dependence can be addressed by 1. One-to-one counseling. 2. Self-help groups such as Alcoholics Anonymous. 3. Taking the medicine. There are 2 main types of medicine to help people stop drinking. The first is to stop withdrawal symptoms and is given in reducing doses over a short period of time. The most common of these medicines is chlordiazepoxide. The second is a medicine to reduce any urge to drink. The most common medicines used for these are acamprosate and the naltrexone. These are both given at fixed doses and you will usually be on them for 6 to 12 months. At this juncture, I want to say thank you for watching. Please kindly like, subscribe, and share.